I will have to tell you that this is actually a research project that is meant to understand the patient distress pathway from the cancer center into the primary care. So we are very much keen on understanding from the perspective of evidences that we have, what does it mean for a person affected by cancer to make this transition from, the care that they receive or he or she receives in the cancer care center, and the outlook of cancer distress screening and management in the primary care settings that most of the patients with cancer are going to live in, because this is the most important and closest place where people affected by cancer are actually finding most of the time their medical help. But we have to make sure that the primary care understands that the cancer patient is a very complicated reality. It's a human reality. So that means that we have to offer also the psychological and social guidance that some of our patients need also in primary care, not just in the cancer care centers. So the CANPRIM project, it's actually the first project in Romania that is on a national level and that is collecting data on psychosocial needs, on cancer distress, when patients are making this transition from the cancer centers into the primary care. And this is a very special thing to do, because we have done in the last 20 years our research in cancer centers. So we had inpatient data on a national level, and now we try to move together with our oncology realities into the primary care, as also we are experiences that more and more patients are living longer and surviving more and more. So, of course, the needs, including the psycho-oncology needs, are moving together with this reality. So I think it's very important to understand that this project was not intended to be carried out in the COVID-19 situation, but still, this was a very good chance to see how does it look like in a double burden situation, the cancer experience from the psychosocial needs. So actually I can tell you that we have many articles which are now in review about the fear of cancer and the COVID-19 fear altogether, and we wanted to see which type of fear of cancer is actually more important or was more important during COVID. And I can tell you one very important conclusion, that from our data, from the evidence that we have collected from more than 330 cancer patients nationwide, we can see now that actually this transition, of course, it's about a kind of psychosocial distress that we counted on. But there is something which is twice fearful for our patients. And it comes back in the face of fear of cancer, which is the loss of independence, the fear of losing independence. Together, or part of this psychosocial burden that comes together with transitioning into primary care, and also for some of them transitioning into survivorship. So that was a very new and important piece that we came across when we tried to understand the fears that cancer patients are faced with in their journey of transition, but also how do they understand it. And cancer distress, it's a major issue, it's a major part of this journey, but also this fear of losing their personal independence is a very significant variant that, came out through our results.